Hello. Welcome to our project overview for Care Transitions for Behavioral Health. My name is Kim Johnson, and I am your host for today's presentation. My colleague Chris Becker and I will be your Medistar representatives throughout the duration of the project. We are so excited to have you join us in this work, and we look forward to your participation. Today's presentation is meant to provide you a high-level overview of the project details. We'll start with a brief introduction to our organization, Medistar, then expectations for the project, technical assistance, and next steps. Medistar is the Healthcare Quality Improvement Organization for Wisconsin. Medistar has been around for a number of years, serving the healthcare community in several different facets. For this particular project, we have partnered with our fellow healthcare quality improvement organizations in Michigan and Minnesota to create the Lake Superior Quality Innovation Network. We work as a region on a variety of projects funded by the Center for Medicare and Medicaid Innovation. We provide services funded by state and federal contracts, including quality reporting, cardiac care, diabetes education, and infection control, to name a few. It's important to note that additionally, under the umbrella of the Behavioral Health Integration Project, we also are partnering with primary care physician offices around the state to increase depression and alcohol use disorder screenings. Your organization may or may not also be participating in that component of this project, depending on the makeup of your organization. In addition to these funding sources, Medistar also provides services for managed care review, HEDIS audits, meaningful use consulting, continuing education, and more. As we get into the project details, let me start again by thanking you for your participation. We believe that this project represents a huge need for Wisconsin and the country at large, and we are very excited to have you join our community. Our overall goals are to reduce 30-day readmission rates, increase 7-day post-discharge outpatient follow-up visits, and increase 30-day post-discharge outpatient follow-up visits. We consider these three unique measures. With each year of participation in the project, we want to continue improving upon your baseline data. CMS evaluates us based specifically on Part A claims data for Medicare beneficiaries. However, it is important to note that all of the technical assistance which Chris and I provide can be used to help all patient populations and payer mixes. So our baseline will be calculated from July 1st, 2014 to June 30th, 2015. Our first year for evaluation will be January 1st, 2016 through December 31st, 2016, followed by the second year in 2017 and final year in 2018. At the end of each evaluation period, our goal is to improve from baseline for all three measures. Our last half year on the project, from January 2019 through July 2019, will serve as our transition to sustainability and potentially preparation for future projects within the behavioral health transitions of care. Now, how are we actually going to help each participant improve from baselines? You may be wondering. This is where we have a lot of flexibility in our approach and expectations on both our role at Medistar and your role as the participant. So please keep in mind that the list I'm about to go through is high level, providing different options, but really it's going to be dependent on what your needs are and where you currently are with your readmission rates and your outpatient follow-up rates. Other things that are going to have to be taken into account are the type of community your organization is in. Are you in a rural health area? Are you in an urban health area? Chris and I will be working with you in the welcome meeting to create the individualized plan for your organization. So to start on the Medistar side of things, we will provide technical assistance to best incorporate different trials for what will improve your readmission rate or what will improve your outpatient follow-up rate. We'll also facilitate learning and action networks and Wisconsin community sharing calls. Our goal here is that you can work with other similar organizations and trial different things that may or may not be successful there. Talk about similar challenges you're having and how we can wrap our expert brains around together to figure out solutions to the problem. We also will be able to supply you quarterly data reports from Medicare Part A claims. You'll have the option as well if you want to provide us data from your EHR, but that's not a requirement. We also will collect and send feedback to CMS on the challenges that all of our constituents are facing and recommendations in moving forward in the behavioral health care arena. I think that this is one of the most important parts of being able to participate with us, is that we have a direct feedback line to CMS because they're our funder. On the participant side of things, we'll need you to identify a project point person. We'll want you to be actively engaged with us, receiving technical assistance, being open to discussing things with our other constituents, and learning and sharing best practices. You'll want to solicit staff buy-in to make sure that they're on board with being a part of this project. And you'll participate in learning and action networks and sharing calls, which is also a great opportunity to include other staff as well, as there will be different focuses in each learning and action network webinar. And again, optionally, if you want to analyze additional patient populations beyond just the Medicare population, you can create and monitor reports from your own EHR or provide us data from your own EHR, and we're happy to help with that data analysis. Our technical assistance may include determining your organization's key stakeholders, workflow mapping, EHR configuration, training, tracking issues and challenges, and trialing different plan, do, study, act cycles to incorporate the screenings into your practice. We have a large repository of quality improvement tools and knowledge experts here at Medistar, so we can help you perform root cause analysis, gap analysis, and any lean methodologies that you as an organization may be interested in using as well. If you already have initiatives or projects in place that look to decrease readmissions or increase outpatient follow-up, we can assist you with these projects. If you're interested in trying new methods for improvement, we can assist in root cause analyses and trialing different improvement strategies. I think of this as several gears turning together. We may be able to improve readmission rates by having improved patient engagement levels, or having a more thorough or standard discharge planning process. We may be able to increase outpatient follow-up by having better care coordination with the patient's outpatient providers through an after-visit summary, or calling the patient one day after discharge to help ensure follow-through and medication management and going to scheduled outpatient visits. There are several different gears that we can introduce here and try to improve upon during the entire project. During the welcome meeting, that's when we'll get into what gears you want to focus on as an organization and formulate that plan for you. In preparation for the welcome meeting, please send me your point person contact information, especially if this is someone that Chris and I have not already been in contact with. Also, please send me some available time options for the welcome meeting. If you do happen to have any workflows documented on your current initiatives to improve readmissions, increase outpatient follow-up, or any other projects that might fall into line well with this, you can also pass those along. However, that is purely optional and not expected. Thank you so much for watching this webinar. We look forward to working with you soon and developing the project plan for your organization. If you have any questions, please don't hesitate to email me. Thank you, and have a great day.